Welcome everyone to our third and final speaker series for 2021 ResearcHERs of Los Angeles campaign. Before we get started, we ask that everyone please remain muted to avoid any background noise. We encourage you to change your view to speaker view, which can be found in the top right-hand corner of your screen. We will also be using the chat button during our Q&A portion, and feel free to use the reaction button to show your support throughout the program. Thank you. We will begin with a brief video about ResearcHERs.
I read about a program that looks for women, scientists, cancer research. And I thought, this is me, I need to be a part of this.
Cancer research is very personal to me. I've lost my mother to cancer. It was just 2 weeks after my mother's passing, and I attended the first ResearcHERs event. The event showed me that sisterhood and unity among women.
ResearchHERs is a movement because of the importance of community, having those friendships between people who are so passionate about cancer and who are so inspiring.
We all have a common bond as women and we support one another. One of the biggest challenges is just obtaining research funds in order to conduct our research.
Funding is the vital part of our careers as academic scientists.
In my research, I've worked with refugee and immigrant populations and trying to get them to get screened for breast and cervical cancer. I think it's important to reach underserved populations, and so the money that is raised by ResearchHERs is so important to help us to continue to do this work.
We are going to raise money that will help save lives. I'm so excited to raise the funds and help support the next breakthrough in cancer with you.
To my younger generation, I want to say we are all gifted with talents and skills and knowledge and experiences. So take what you know and make the change that you want to see.
We shouldn't give up, and we are not allowed really to give up.
We're all bringing so many new things to the table, and accumulation of all these new things is where the answer to cancer lies. That's where we'll find our cure.
Even when we're apart.
We are in this together.
And together, we'll find a cure.
Many thanks for being a part of the ResearchHER Sisterhood.
Hello and welcome to the ResearchHERs Women Fighting Cancer of Los Angeles 2021 Speaker Series. My name is Kelsey Davis and I am the American Cancer Society staff lead for the Los Angeles ResearchHERs campaign. This is a three-part speaker series titled Conversations in and Out of the Lab. And today's topic of discussion is health equity throughout the cancer continuum. Today, you'll get a chance to hear from women leading cutting-edge cancer research in Los Angeles. To kick off our program today, it's my pleasure to introduce you all to our virtual MC, CBS2 co-anchor, Suzanne Marquez. Suzanne co-anchors CBS2 this morning weekdays at 4:30 a.m., 5 a.m., 6 a.m., and 11 a.m. As an Emmy Award-winning reporter, Suzanne has been with CBS2 since 2011. Suzanne loved journalism at an early age and was editor-in-chief of her elementary school newspaper at Rio San Gabriel in Downey. She hosted Downey High School's assemblies and pep rallies and won the speech portion of the Miss Downey pageant. Suzanne graduated from USC and started blogging while attending the university. She interned at NBC.com and NBCLA.com. She was hired as web producer at KNBC after graduation. We are so thrilled to have her joining with us today. Welcome, Suzanne.
Thank you so much, Kelsey, and good afternoon, everybody. I'm so happy to be here, a part of this incredible program, raising awareness and funds for women-led cancer research. It's so nice to have women helping other women. As we heard in the introduction video, women make invaluable contributions to cancer research, yet they're consistently underrepresented in research leadership. The ResearchHERs campaign wants to change that. Together, we can sustain women-led cancer research, bolster the careers of women researchers, and support a more robust pipeline of female leaders in cancer research. While ResearchHERs raises funds and awareness for all kinds of cancer research led by women researchers, today's discussion will highlight health equity throughout the entire continuum. I'm thrilled to be here to support women-led cancer research, and I want to share that cancer research is very close to my heart because my mother had melanoma on her face that she thought was, just a little itch, a little scratch, maybe something surfacey, something you get burned off. But as we all know, melanoma is very serious. And I helped my mother through her cancer battle over the past few years. Now we live together with my husband and my son, and we're able to keep an eye on her. But that's just one really direct way cancer has affected my life. But I have so many friends, colleagues who have overcome all sorts of cancers, prostate cancer, breast cancer, you name it. I feel like all of us know somebody with, the degrees of separation that connect us all. So thank you all. I'm so blessed to be joining today and for being a part of this important movement. I'm excited for today's program. The American Cancer Society would also like to give special thanks to this year's sponsors. Culver City Honda as a silver sponsor, Cedars-Sinai as the gold sponsor of this year's campaign. Two of our panelists are representing Cedars-Sinai today, so we'll get to hear about their cutting-edge research happening at Cedars today. Thank you all so much to the sponsors. This is how it's able to happen. Everyone, please show them some love in the chat box. You get to test your fingers out too. Get ready for those questions. Thank you for your dedication to our mission and funding women in research. Today's event is the third and final in this three-part speaker series, Conversations in and Out of the Lab. These events have been an opportunity to hear from women leading cutting-edge cancer research right in our own backyard at incredible institutions around LA County. Today, we have the privilege of highlighting two women cancer researchers from Cedars-Sinai, one from Keck School of Medicine at USC, my alma mater. Again, today's topic of discussion is health equity throughout the cancer continuum. Health equity is a critical part of the American Cancer Society's mission. While it's important to celebrate the decline in cancer deaths that we've seen over the past 25 years, we have to recognize that advancements in prevention, early detection, and treatment have not benefited us all as women equally. ACS is working toward a future where everyone has the opportunity to be as healthy as possible, including preventing, detecting, treating, and surviving cancer. Health equity research is a big part of this work, and the American Cancer Society has $50 million currently invested in research grants focusing on health disparities and health equity research. We're excited to hear today about how this research of our panelists advances health equity. So let's transition now to hear from a group of researchers making exciting advancements in the fight against cancer. Today, we are thrilled to have with us Dr. Christy Jeanne, Associate Professor of Medicine, Division of Hematology Oncology at Cedars-Sinai, Dr. B.J. Ryman, Assistant Professor, Department of Obstetrics and Gynecology at Cedars-Sinai, and Dr. Jennifer Sway, Associate Professor of Population and Public Health Sciences at Keck School of Medicine at USC, and a member of the USC Norris Comprehensive Cancer Center. Dr. Sway is also an ACS-funded researcher. You can find their full biographies for each of our panelists on the Los Angeles ResearchHERs website. We have an incredible lineup of panelists today. I'm so glad we have a conversation to learn more about this research that you all do, and also your journeys and experiences in the field of cancer research. I'll be starting out with some questions for our panelists, but I want to ask our audience members to please feel free. Ask your own questions as we go in the chat box. I have it popping up in front of me so we can be right with it. Kelsey is monitoring the chat, so she's going to be sending them my way, and I'll ask her for a few questions from all of you a little later. Okay, let's start our panel discussion. Here we are, all are. I have each researcher share about the type of cancer research that they do. Let's start with you, Dr. Jeanne.
Hi, everyone. I'm Christy Jeanne. I'm an epidemiologist, and I conduct research on epidemiology of gastrointestinal cancers, how we can detect them early, specifically pancreas and gastric cancers. And these are cancer types for which 5-year survival doesn't even reach 50%. So there's a lot of gains that we can make in terms of cancer prevention and early detection.
And how about you, Dr. Ryman?
Hi. So I'm a gynecologic oncologist. I treat women with gynecologic cancers, so things like ovarian, uterine, and cervical cancers. My research is focused on those cancers. Most specifically, I do clinical trials that provide patients with a chance to receive novel therapies. We examine those novel therapies to see if they're better than the standard of care. And if they are, then those therapies will go on to become the next standard of care. So I'm a clinical trialist.
And Dr. Sway?
Hi, everyone. I'm Jennifer Sway. I'm a health services researcher and a population scientist. And most of my work is focused on studying access to, delivery of, and the quality of cancer care. So I'm really interested in looking at the organization of cancer care delivery, patients and population groups that aren't getting the optimal care that they should be receiving, and how we can focus on improving that care quality across the cancer continuum. Most of my work is in the areas of cervical cancer, breast cancer, and colorectal cancer.
Okay, so this question will be for all the panelists, and I'll go in order like we just did. And as questions pop up, as you're watching, when you see the doctor talking, look for the name and send in that question if you have something specific, now that we all know their backgrounds. So let's start with our first question. Can you give us an overview of the type of research that you conduct?
Did you want Dr. John to go first?
Oh yeah, sorry. I meant let's go in round robin like we did first. So Dr. Jean.
Sure. Specifically, I'm interested in, there are kind of two main areas I'm interested in is, so pancreatic research wise, we don't have a way of detecting pancreas cancer early, but actually there are some signals in our physiologic system that could signal an elevated risk. And one of these includes a change in our glucose metabolism. Another is weight loss. And so we are partnering with veterans of the VA, Veterans Affairs in Los Angeles, to be able to find a signal that could predict pancreatic cancer early enough so that curative resection is possible. So that's one type of research I do. I'm also interested in better understanding people's acceptability for gastric cancer screening, for which we don't have very clear guidelines. And gastric cancer screening needs are specifically felt in people with higher risk, people from Asia and South America. And this is where we can make some targeted screening guidelines, and we need better evidence.
Okay, Dr. Ryman.
Sure. So I study mostly endometrial and ovarian cancers. Specifically, I develop clinical trials. One of the ones I'm working on right now is the addition of a medicine called a statin, which people take for high cholesterol, in addition to adding that medicine to the chemotherapy cocktail that we give for patients that have a recurrent ovarian cancer. And that clinical trial is examining if the addition of this medication can actually improve the responsiveness of the cancer to the chemotherapy. It's a medication that work like Dr. John's work in epidemiology determined that patients who had been taking a statin seemed to live longer if they had ovarian cancer than those who did not. And we're testing that out in a very controlled way to see if we're correct that finding that was found in a large population really holds out as true in a very carefully monitored, very homogeneous population of ovarian cancer patients.
Okay, Dr. Sway.
Sure. So I have sort of two major areas of research right now. A lot of my work is very focused on understanding insurance-related barriers and access-related barriers to appropriate screening, treatment, and also survivorship care. So I really work across the cancer care continuum. My ACS-funded research study is actually focused on transitions patients have from diagnosis into oncology care. So what happens specifically for underserved patients or patients that routinely seek care in safety net settings or are covered by Medicaid insurance. We know that there are a lot of both individual level, community and structural level barriers that prevent that timely transition into cancer treatment. And so that work is really aimed at understanding what's happening at all these different levels and what is the complexity that occurs in trying to get patients into the cancer care system as quickly as possible. A lot of it may be policy and health system driven. Some of it may be provider patient encounter driven. And as we know, as we've seen in the science for quite some time, there are a lot of individual level barriers as well. So it's really developing sort of the ingredients we need for ideal teams and then health system and policy drivers that can improve this process. The second area of research in which I actually engage with a lot of ACS members with is on HPV vaccination. And so I have a study currently looking at what are the evidence-based strategies we have within primary care settings to improve HPV vaccination, which prevents cervical and other HPV-associated cancer sites. And what can we do at that pediatric adolescent healthcare delivery level to understand what is happening, right? Why are we not seeing the uptake in HPV vaccination rates like we see in other adolescent immunizations? And what can we do about it, particularly in safety net settings as well, where we know adolescent girls and boys in these communities have higher risk of HPV infection, have other behaviors that might put them at higher risk for developing HPV-associated cancers later down the line.
Well, your answer, Dr. Sway, flows perfectly with the next question. Can you all share how the research that you do advances health equity? And we'll start with you again, Dr. John.
Health equity is a really important focus of mine. It's one of the reasons why I got into the cancer research space. So gastric cancer is a notable cancer type for which we see very different incidence rates between races and birthplaces. So when we look at Korean and Vietnamese American populations, we see that their gastric cancer rates are almost equivalent to colon cancer rates, for which we have national level screening guidelines. For gastric cancer, we don't have targeted screening guidelines. And so I'm currently doing a pilot study where we want to better understand the community's perceptions of gastric cancer screening, providers' perceptions of gastric cancer screening and who needs them, and then just the current status quo. If somebody wants to be screened for gastric cancer, how is it paid for? Who's the payer? And what are some of the challenges in the decision making there are about gastric cancer? So that's kind of one area that I've started looking into. Another area that interests me is pancreatic cancer, and this is an area also for which we have very different incidence by race, and African Americans are at increased risk for pancreatic cancer, and this is not exactly known why. We don't really know what the mechanism is for that disparity. So getting to understand that better through medical records information, also through understanding health behaviors like smoking or alcohol or any other types of behavior is something that I'm also invested in.
Okay, Dr. Ryman.
So my research in clinical trials has a significant health equity bend. We study in our group why different patients may or may not elect to participate in a trial that may offer them a new therapy, or what barriers there are to their inclusion. For example, in Los Angeles, we have enormous numbers of patients who prefer to use a different language than English as their primary communication method. Allowing and making sure that those patients can participate in clinical research is really important to us. And we've developed some strategies to try and make sure that we have adequate knowledge about how to include those patients and appropriate resources to make sure that the information is available in the language which they prefer to communicate. And that's a way that we're sort of providing that equity piece and working on discovering other barriers that may exist for patients that may be cultural. There are areas that people may feel a mistrust about trial work, and providing them an opportunity to voice those concerns and understand why communities feel that way allows us to help bring better equity into our clinical research.
And Dr. Sway.
Yeah, so, I think as a health services, cancer care delivery, and more recently moving into this area of implementation science, we're naturally sort of focused on understanding where the gaps are in quality and delivery, right? And so naturally, health equity is always an issue that gets raised. It's sort of inherent in trying to raise the quality of care we give to patients. Quality won't be there if we're not focused on making sure it's available and accessible to all patients. I think what's sort of a relational bend to my research compared to what the basic scientists and clinical scientists have done in the field for the last several decades is that, we have evidence of HPV vaccines, for example, early detection screening modalities. We have treatments and guidelines for what optimal treatment could be or should be. And so my work is really at that other end of it in trying to figure out who's not getting what could be the best available option for them, right? No matter where they are on the continuum from the cancer prevention end all the way through treatment, and then what should they be doing in survivorship care? Yeah.
Great. Okay, this question's for Dr. Jean and then Dr. Ryman. We'd love to hear how you got into this type of work. Can you share a little about your personal journey into cancer research and where you stand today?
Sure. So I was quite intentional from my undergraduate years to get into the space of public health. It was very interesting to me to see differences in disease occurrence by geography, by exposure, by race, by ethnicity. And I learned fairly early on that if you get trained in epidemiology, you can continue to study that and also unpack potential causes of diseases. So that's how I got into epidemiology. And it also has a lot to do with health equity, because when you see these data patterns emerge, you begin to wonder why are these different populations experiencing different incidents of disease? And is that driven by different causes that they're exposed to? Or is it driven by, like Dr. Sway was saying, healthcare delivery? Are they missing out on opportunities? And so it's been very gratifying to become an epidemiologist because it gave me a path to investigate things that interest me kind of personally, and I was already passionate about. And, after I pursued the master's degree in epidemiology, aiming to become a specialist, but somebody who kind of also supports projects more than, rather than lead it. But as I finished my master's degree, I realized it was so interesting that I wanted to study more. So that's how I got pursued a doctoral degree in it. And it just kind of blossomed from there. And I think that the major driver of becoming a cancer researcher was just seeing those data patterns and being able to discern, that, the methods and the skills that we have can help to identify causes of cancer and also inform prevention methods that could lead to cancer reduction, and reduce health inequity. Those were a big motivation for me for becoming an epidemiologist. And I feel very privileged that I am able to continue in my career to that passion that I held for so long, that it's directly relevant to my career and my everyday life.
I love that. Dr. Ryman?
Sure. So in medical school, I got into medical school because my first career choice didn't work out. But in medical school, you go on these rotations and you go throughout the hospital and experience different types of medicine, internal medicine, surgery, dermatology, radiology, different things. You kind of get to experience, try that on and try sort of like what it's like to be doing that job. And one of my rotations was gynecologic oncology. And gynecologic oncology was these incredibly passionate humans who did surgery and they did research and they provided chemotherapy. And I said, why are all the other specialties, you just do surgery or you just do chemo for cancer? And it turns out this really old person sat me down and said, in the 1950s and 60s, they didn't think that women were strong enough to be operated on for their cancers. And so the only people that would operate on them were their gynecologists who recognized that they could manage. And out of that developed the specialty of gynecologic oncology. These people sat around and were like, we can do that. We can provide cancer care for women with reproductive cancers, and we can do it all. Women are worth it. And that really resonated with me. And I was like, oh, I need to be one of you. Fast forward 12 years of postgraduate education, and now I get to do that job. And I really think that sense of equity, that the women that we care for are absolutely worth our best effort, that our research and our late nights and our crazy curriculums and our crazy schedules are absolutely 100% worth it. And that really continues to, I hope, come forward in the work that we do as researchers, where we want to continue to find, the next thing for our patients who we think are absolutely worth that effort.
And Dr. Ryman, a follow-up question. How has cancer affected your life? And just the statement you made about how women weren't believed to be strong enough, I mean, that's going to stay with me forever. How did the cancer experience, though, affect your life and your family?
So my very best friend from college called me on my very first day of medical school, and I assumed it was to congratulate me on my awesome first day of experience and to tell me everything. And she said, I gotta talk to you. I pulled my car over on the side of the road because I had so much abdominal pain when I was driving home from work, and I ended up in the ER, and I have a 9-centimeter liver tumor. And over the course of the next year, I worked as a student and called and participated in as much of her care as possible until she ultimately succumbed to cholangiocarcinoma, which is a very rare liver cancer. And that impacted me immensely because I kept hearing from her doctors and caregivers, it's really rare, we don't know a lot, we're going to try this thing, we're going to try this other thing, we're going to talk about a clinical trial. And my beloved friend participated in several clinical trials before her untimely death at the age of 26. So that really drove me to want to be a part of expanding the options for patients.
That's incredibly moving and powerful. And your work she lives through your work now. And, I'm sure just that personal experience really helps you with all of your patients. This is a question for all panelists. What stands out in your memory as the happiest moments or greatest joy as a researcher? It doesn't have to be the most, because I know that could take forever to decide, but at least one good memory.
I could go first again. Just to respond to Dr. Ryman's story, it's my uncle succumbed to also hepatitis B related liver cancer. It's a different type of cancer than cholangiocarcinoma, but those are good. They affect us, and they're always around us, and those are the saddest moments. At the same time, those become our very motivators. And so just on the opposite side, happiest moments are when as academics, we at least for me, like when we feel most validated when we realize that we're right. So just making those discoveries, when you start an investigation, you have a hunch, you have some preliminary idea that you you may have a new hypothesis that may or may not be true. And then you design a study and you collect all that data and you analyze it and you pour all this time and it's just this labor of love, long incubation periods of just, collecting and looking at data from a lot of different angles. And then after all that, when you realize that you were right all along, those are really gratifying moments. They don't come very often, but I would say those lead to the greatest joys because they are then the impetus for which we can provide cures. We can provide prevention methods for the friends and families of our lives and our community, So yeah, those are my happiest moments. And, Dr. Ryman and I have looked at some investigations together where we're like, well, what kind of drugs can potentially be, have some preventative or, curative effects on, ovarian or pancreas cancer outcomes. And we realized that, statin has that potential. And so that was a really gratifying discovery as well.
Great. Dr. Sway, how about you? A great memory or just moments that make you the happiest?
Yeah, so, I think that sometimes as scientists and academics, we get the stereotype that we're introverted and we work sort of alone in our little lab, but, it's quite social, right? A lot of our work is in developing relationships, and understanding why our data makes sense actually requires us to go into the field and understand what's happening in the real world, right? Talking to everyone from elected officials, policymakers, insurance payers, all the way down to what's happening in the clinic between providers and physicians and patients. And I think my happiest moments are always when we are out there in the real world, and then you get to have that conversation with, patients, with parents, and they tell you, I had heard of this vaccine, for example, and I don't know why I never really looked down this route and tried to figure it out, but this gave me an opportunity, right, to think deeper and to make the decision and to start that conversation with my team, right? So, I think it's just that ability to connect, even though as a population scientist, we're always about the numbers, right? And sort of what's happening at this larger, more global community, state, county level. But then it's that one-on-one, day-to-day, I think that keeps us going and motivated.
And finally, Dr. Ryman, so moving, your most heartbreaking moment. So your best moment will be delightful, I'm sure.
Well, just to sort of echo what Dr. Sway and Dr. Jean had said, that these research moments when you find out you're right are really amazing. And the validation that comes with receiving a grant is amazing. And I've had the privilege of, because of the type of work I do, I actually get to give the drug that I studied, that I worked on, to the patient. And I'm old now, so I get to live and see that happen. And that has really been a joyful moment for me. I was able to pull out the paper and hand it to a reticent patient and say, I wrote this, and this is why we're going to give you this. And it felt really good to have that moment.
Oh, that's amazing. You're affecting generations. So this one's for Dr. Sway. What does it mean to you to be funded by the American Cancer Society?
Where do I start? Well, first, I am immensely grateful for having a 5-year grant. It's 5 years of funding where I get to focus on a topic that I'm passionate about, that I think will have impact on how care might change or how care might be delivered. But I think it also means that, I'm part of this larger mission. And I don't often, you don't always get that opportunity through other funding mechanisms, right? As an ACS funded researcher, you really get tapped at the national level. So I've done grant reviews. I've gotten to connect with other researchers who do the same type of work that I do in other states. But I also get connected to local level ACS staff and leaders, which I think is really important because you feel like there's a connection, but also a direct line to the groups of people you're trying to impact in the community. So Raquel Arias, who's on this call, for example, we see each other at various HPV Vaccine Coalition meetings, other aspects around the state. And so you feel like you're part of something bigger than perhaps just your own research study. And I think that's really important. It helps me just engage with the bigger picture, which as scientists, sometimes we really need to remind ourselves of.
And let me follow up with you. We're going to ask this of everybody though, but what advice would you give to the young women out there who want to be a researcher like you?
Oh gosh. I mean, the first is that, you know, science is not always linear. It's not sort of consistent and goes in a line. It's very non-linear. You have new things sort of coming at you. There are new avenues to explore. And also there are ups and downs, right? You don't always get that first grant submission or the second grant submission or the third grant submission, right? And so it's just being able to see and stay true to your bigger motivation, right? Because then that will carry you through kind of the ups and downs and the zigzaggy waves of what happens throughout your research career. So that's what I would say.
About you, Dr. Ryman?
I would say knowledge is never wasted. My first science mentor always used to say that. And I was like, why are you going on about it? He's like, you need to keep looking at all of the different things. Don't just stay in one, just at one thing and only read about ovary cancer, right? Make sure that you know what's happening around the rest of the cancer space, because what we think is disconnected sometimes isn't. And so make sure that your mind is broad and try to keep your interests and reading fairly diverse so that you're open to the really a good idea when it comes across.
And Dr. Zhang?
I echo both of what Dr. Ryman and Dr. Tsui have said, and I would just say build some stamina. Research is for the long haul. It can be very gratifying, but that path could take some effort and it takes some patience. And so once you build that stamina, then you can stomach through all the funding failures as well as the funding being funded and then delivering on the funds that you received. And and then you realize that as you do that, you are kind of running this marathon with other people around you, and you build that community and it becomes this shared experience, and you'll enjoy that. And it's kind of, you become these group of strong women over time.
Well, this has been incredible, just hearing your personal stories, but also your motivation and your joys and celebrations, and just learning so much about what passing on the knowledge of what you've gleaned from experience and mentorship. And the chat has been going this entire time. I already noticed that Dr. Sway already answered one. You're very efficient. So let me open it up to everybody else. And while we're doing this question, if something pops up, feel free to add it to the chat because Kelsey is monitoring it. But here's the question. What conferences do you recommend attending that highlight research that focuses on gender and/or racial differences in cancer outcomes? And Dr. Sway, do you want to talk about it? I saw you posted it, but maybe you can elaborate.
Yeah, sure. The American Association for Cancer Research, AACR, they have an annual targeted focused conference specifically on cancer health disparities in minorities and medically underserved. I've been going for quite a few years now, and I think something really important about that conference is they have a special advocacy panel at the beginning. They like to highlight survivors and advocates in the field. So it's not just researchers sort of talking to each other. So that might be one to look into.
Okay, Dr. Ryman?
I would go with the AACR conference. That's a really enormous national conference that a lot of us look to as sort of the primary place to go.
Okay, Dr. Zhang, I have that question and a follow-up for you.
Sure, I echo Dr. Tsui's that the health equity specific cancer by AACR is a really good one.
Okay, and since I have you, here's a question from the chat. Do you think we'll ever have routinely recommended cancer screening for gastric cancers and pancreatic cancer?
So unfortunately, currently, we do not have guidelines for early detection cancer screening for pancreas nor gastric cancer. We do have a method to be able to detect gastric cancer early on. It is just not a national level recommendation. It is recommended for first generation immigrants who are from high places where gastric cancer is common. These include some countries in South America as well as East Asia. So I am researching the very thing that we want to build the evidence for, is that we need targeted gastric cancer screening, because we have a very good way of detecting gastric cancer early, at an early stage where surgical resection will completely cure the patient from cancer. Pancreas cancer is one type where more than half the time pancreatic cancer is discovered, we detect it too late. It's metastatic by the time we discover it. So there are very active research going on currently at the national level to be able to detect pancreatic cancer early. One of those projects that I'm involved in is called the New Onset Hyperglycemia and Diabetes Cohort Study, and we're trying to better understand how we can distinguish changes in our glucose endocrine system that relate to potential neoplastic, so tumor development in the pancreas, as opposed to the regular type 2 type of diabetes. And I think in the future, I have some hopes that that could lead to some early detection guidelines, but currently no screening is recommended, except for people with family history of pancreatic cancer, or some people with specific germline mutations like BRCA. For those patients, which is a minority of the patients who end up having pancreatic cancer, there is now a targeted guideline for screening by endoscopic ultrasound or by MRI. And if you want more details on that guideline, I'm happy to share it with you.
So Dr. Sway, we have 2 questions left. What are some reasons that people aren't getting recommended treatments?
So I think something that the field has moved into more recently is this need for us to examine things from a multi-level perspective, right? I think, a lot of the great work that was done early on was very focused on individual level, right? Do they have the right insurance? Do they have a doctor? Are they asking the right questions? Do they have knowledge and awareness about specific diseases? But as we've moved forward in this field, we've realized, providers and the clinic team, there are ways to improve that delivery in that setting as well, right? Particularly in our community settings where we don't have great hot off the press knowledge like our clinician scientists do at large cancer centers. We also know that there are structural inequities, right? We've seen this sort of come to the forefront over the last year in sort of long-term systemic racism, inequity, residential segregation, all of the things that are at the social determinants level that also impact why people don't get good care. We know that there are social needs that the healthcare systems and the healthcare settings are just finally starting to pay attention to, right? Aspects around transportation, obviously, but also housing and food insecurity, these day-to-day type barriers that really impact, even if a patient knows they need to follow up, they need to start this treatment, or they need to go back again to get their routine treatment, there are just so many other factors in life that may have to be prioritized.
Okay, last question. Dr. Ryman, is there an advancement in gynecological cancer that you are particularly excited about? I love that we're ending on a female-based question too.
Sure. Yeah, so one of the things we're really excited about is the development of these new pills called Parp Inhibitors. And these new pills, we had the opportunity to have these trials at Cedars, and they're basically allowing patients with a very specific mutation to start these pills after they complete their chemotherapy. And it's improved the overall survival for patients with a very specific mutation by 50%, which is just huge. And we're hopeful for even more gains in ovary cancer in these sort of oral drugs over the next few years.
Wow. Well, I'm just humbled by all of the work that all of you do. You're leading all of this research right in our backyard here in Los Angeles. So we know our future is bright, but we need everyone's support to keep that pipeline of female-led. Oh, did we go away? Or no, maybe it's just the screen. Okay, we're okay. The future is bright, but we need your support to keep that pipeline of female-led cancer research projects full. At this time, I'm going to turn it back over to Kelsey Davis to share with you more about ResearchHERs campaign and how you can get involved. And you can also see every doctor represented here with your incredible insight, your research, and everything you're adding to it. You really are doing a service to all of us.
Thank you so much, Suzanne, and thank you to our amazing researchers. Before I jump in to share more about how you can get involved with ResearchHERs, I want to make a quick mention of another exciting event that is happening later today. Tonight, the American Cancer Society Cancer Action Network, ACS-CAN, our nonpartisan advocacy affiliate, is hosting a virtual California policy forum focused on cancer research through a health equity lens. This event will be more focused on the policy conversation, specifically what policies should we put in place to ensure that the amazing advancements in the fight against cancer can benefit everyone. Since the topic relates to the topic of this researcher session, we wanted to make sure to let you know. Please share with others that you think might be interested. I put the link in the chat. We know it's short notice, so don't worry, it is being recorded. And we will put it in the chat link, like I mentioned, and you can join also tonight at 5 p.m. Now back to ResearchHERs. As we all know, cancer research doesn't begin and end in a lab or over a set of data. It's all focused on helping everyone prevent or survive cancer. Your support throughout fundraising can make all the difference. The next great cancer discovery could be sitting on a shelf as a grant application right now. During the past few years, we've seen hundreds of women who have signed on as ambassadors from various industries, including business, biotech, academia, the medical and healthcare field, and even college and high school students. Currently, our 2021 Los Angeles campaign is represented by a diverse group of strong female leaders. Our ambassadors are passionate about women-led cancer research and have joined the movement to raise awareness and critical funds for the American Cancer Society. I would like to recognize and thank our current 2021 ambassadors, Carolyn Rhee, Diana Jamal, Navarre Meridian, Pilot Paisley Rose, Aaliyah Mineta, Nikki Mohajer, Cynthia Begay, and Caitlin Carmichael. They are all leaders in their communities who share our passion to fuel the future of cancer research. Thank you for all that you do to support women-led cancer research. Because of your commitment here in Los Angeles, the American Cancer Society can continue to fund women-led cancer research, crucial patient care programs, and education and prevention initiatives. The 2021 Los Angeles ResearchHERs had a strong team of ambassadors who are looking for more to join us in the fight against cancer. As we close out the 2021 campaign, we are looking for more passionate community leaders to join us in 2022. Some of us on this call are actually going to be joining us for 2022. We're super excited to have our new ambassadors joining us. Your support could fund the new cancer breakthrough that saves thousands of lives. The money raised through ResearchHERs will fund women whose innovative research ideas and dedication to discovering life-saving breakthroughs are bringing us closer to a world without cancer. There are many ways to get involved. You can donate to ResearchHERs, nominate a powerful candidate, or join as an ambassador and take on the challenge yourself to fund research that can save lives. If you or someone you know is interested in becoming a ResearchHER ambassador, please visit our website at acsresearchers.org. I also put it in the chat. Visit our website for all the information and to make a donation. Please show your support by making a donation of any size to Los Angeles ResearchHERs campaign. All dollars raised will go to fund women-led cancer research. Cancer hasn't stopped and neither will we. With your help, we can sustain support of the best and brightest cancer research led by women. We look forward to having a strong team for 2022. Thank you. And I'll turn it back over to Suzanne.
Thank you so much, Kelsey. It is so inspiring to hear about all of the different ambassadors and the way they've been able to raise funds. And I look forward to seeing the campaign for 2022 grow even bigger. It's just incredible what everybody is doing out there. And they are the future of the research that will be happening. And also, hopefully, a lot of this research will be happening here in Los Angeles. And we want to thank everybody today for participating. Thank you today to the host and gold sponsor, Cedars-Sinai. Special thank you to our panelists and researchers, Dr. Jean, Dr. Ryman, and Dr. Sway. And thank you for supporting our mission to save lives from cancer. We value your continued partnership and hope you will join us again for next year's campaign. I'm sure there's so much more to say. If we had more time, we could just talk all day. And you can see on your screen right now, there is a link where people can donate as well. And I'm so grateful to be part of this conversation today. CBS2 has been a longtime supporter of the American Cancer Society here in Los Angeles and helping to raise awareness about this important cause. So if you are interested in learning more about ResearchHERs or want to get involved, just reach out to the local American Cancer Society staff partners who will be emailing you after the event. Thank you, everyone, and have a great day. I learned so much. I still can't believe that they didn't think women were strong enough to be operated on in the 50s and 60s. If men could give birth, they'd know just how strong we are and our pain tolerance. I think I don't have the official research numbers, but I can safely assume ours is a lot higher.
Thank you, everyone.
Thank you, Kelsey.
Thank you.